And so the idea today is to talk about the bacterial involvement in the PRDC. And I have a question mark. It is a teamwork, and we will see the example of APP. So as you all know, the person respiratory disease complex is a syndrome that describes a mixed respiratory infection of multiple etiology. You know that there is a decreased feed intake, fever, cough, some respiratory signs that may result in death, and with the variable morbidity and mortality depending on several conditions. It is important, we are going to come back on this, that we think on the infectious agents that are involved, but there is also non-infection factors that may contribute, like environmental type of production system and management, big specific factor, and we will come back with example. So this is a list. This was published by Tanya some years ago. This is a list of the members that may contribute to the PRDC. Then you have a lot of bacteria that are involved. So the question is, are they all important? I will begin for a few seconds with a very clear example. One of the examples is strep suis, which is here it is stated that it has a minor relevance. Why? You know, everybody knows that strep suis invades through the respiratory route, mostly. However, can strep suis be considered a respiratory pathogen only because it goes through the respiratory route? There are some lesions that have been described, at least in the lungs, but these lesions are usually found in lungs with other pathogens also involved. When we perform experimental infection, I would say that almost never you will observe respiratory clinical signs. And most of the lesions are a consequence of a systemic infection. As I mentioned, there are many papers that will describe isolation of strep suis from lungs as slaughter, but almost always, I would say always, with the presence of other respiratory pathogens. But in addition, strep suis can be also isolated for 20% of healthy lungs. We know also that there is post-mortem invasion of the lung by the strep suis. And if you take a look to different papers, when isolates are evaluated on pathotype, let's say if that isolate is important or not, lung isolates are usually considered as opportunistic. And we and most people will not recommend to include strep suis isolate in an autogenous vaccine. So it is clearly a minor relevance for this pathogen, and usually specific control measures for strep suis respiratory infections are usually not recommended. But it's not always so easy. We are going to talk today about APP, which is considered of a major relevance. So, if it is a major relevance, can we consider APP as a loner? Alone, it will cause disease. You will see the presentation is just to tell you that this is not an easy question to answer. So, it is loner, and you will see all along the presentation, I will say yes and no. And we will see some example. APP, you know, is the etiological agent of swine pneumonia. This is a very hyperacute case. Lesions that you observe at the black area of consolidation. There are some edema, and always you will find some pleuritis with fibrin that is deposed. So these three characteristics that are present in most cases. It will depend on the acute or not acute phase of infection, but it will usually be present. There are 18 serotypes that have been described, and you have the bacteria, you have the capsule, the outer part of the cell wall, the LPS, which is the cell wall, and some toxins. And you see here, there are 18 different serotypes, and you will see that the serotype is given by the capsule, and each capsule is different. So each serotype is different. We still do not know which are the composition of serotypes 16, 17, and 18, but up to serotype 15, each serotype is different, with the exception of serotype 9 and 11. You see there is only this difference, and because they are so close that they are mostly considered now as a single serotype, very difficult to differentiate. And then you have the cell wall. The cell wall is the LPS, and some serotypes share the same LPS, like serotype 3, 6, 8, and 15. And that's the reason why in the ELISA test used in serology, you will see there are cross-reaction with these serotypes, or serotype 4 and serotype 7. You see here is the same LPS. Then you have serotype 2, which is a unique one, or serotype 5, that is a unique one, and this is the base of different serological tests. Then you have the toxins. There are 3 toxins mainly that are involved in the pathogenicity of the strains. Most of the serotypes will produce 2 or 1 of the toxins, and there is a 4th toxin, APIX4, that is produced by most isolate in vivo without differentiation of the serotype. So how the infection of APP can evolve? Then you have the peracute infection. We saw the picture that will always, almost always, lead to death. You have an acute infection that either finish in death, or they can go to more than a subacute or chronic infection. The subacute infection, when you don't have serious clinical signs, some clinical signs only, will usually lead to a chronic infection. And a subclinical infection, that means animals that do not present clinical signs, no lesions in the lungs, can either remain like that, go to subacute or even chronic infection, but all of a sudden can also cause death. So we talk about the major relevance. So APP is the primary agent of respiratory disease. Let's consider when you have the disease, we have obviously the involvement of the bacteria, pathogen, we have also some co-infection, we have environmental factor, we have management factor, and the immunological status of the animal. Let's begin by the APP itself. Some serotypes are highly virulent, some serotypes are moderately or low virulent, and rare exceptions may occur. This is important. Not all serotypes have the same virulence in all countries. As we will see now a table, the most important serotype in one country is probably completely different from another country. And very often isolate will induce disease alone, no need of co-infection. So if I say this, I say that it is a loner. So this is why what we can say, yes, APP may be a lone cause of the disease. However, you have other situations that occur very often that hares may be infected by virulent serotypes, but without presenting clinical signs and lesion at the slaughter. So this complicates the answer, because in these cases, can we say that it's a loner? In fact, no. So that is why the first answer was yes and no, because it's a difficult, again, I will repeat this many times, it's a difficult question to be answered. Some serotypes are important. In America, 1 and 5, 2 and 9, 11, 8 in the UK, 4 in Spain, and so on. So these serotypes very often can cause disease alone, but sometimes can be present without causing clinical disease. Then you have other serotypes, and these are occasionally isolated: serotype 12, serotype 15, serotype 7 in some countries, serotype 8 in some countries other than the UK, that are rarely isolated. And when they are isolated, you have a couple of animals dying, nothing more. So there is not really an outbreak. So here, the question, if it is a loner, usually is no, because usually there are other aspects of the in the herd that make this specific serotype to cause disease. So what can help APP to cause disease? Obviously, we were talking before of the co-infection. When we talk the co-infection, obviously, we talk about the first one is mycoplasma, and I have nothing to say about this. Dominique will give us a talk about that, but it's by far the most important pathogen that will work with APP. So an influenza, the problem is who helps who, because what has been demonstrated is that APP is probably will potentiate the infection caused by swine influenza virus, since it will be more virus replication. So, but anyway, even if we do not know who helps who, there are convincing data from the field that these two pathogens can work together. Pasteurella multocida, more severe lesions in lungs, but in this case, Pasteurella multocida is really a second invader. Pears. And I know if I talk to European practitioners, many of who are probably listening to this presentation will say, yes, definitely, Pears is a cofactor for APP. The problem has not been demonstrated. It is not in America, probably maybe due to different strains, but you should be careful because sometimes are animals affected, in the post-weaning period by Pears, and then you have at the end of the finishing unit, you have some problem of APP. It's very difficult to have a link between these two infections. And again, in experimental infection, not easy. It has not been clearly demonstrated. May take this into consideration, but it's not the first thing to think about. Then you have the environmental factor and the management factor that will collaborate with the disease. These are a list, which is probably a partial list, which is surely a partial list. You have insufficient ventilation, rapid changes in the temperature, we are talking environmental, high humidity, lack of solid partition between pens. Farm management, mixing animals from different origin, that is extremely clear. Lack of all in all out, or imperfect application of all in all out, how animal density, and this older weaning age. I don't have time here to discuss this. If you have questions, we can come back on this because many of you may ask why older animals at weaning age may lead to more cases of APP, which is what is presently being observed in many countries in Europe. The problem is this factor, that is very nice. We read this factor in a presentation, easy to me to tell you, have a list or to read in a book, but it's never black and white. So you modify one factor is enough. You need two factors, and how is the modification? How is imperfect application of all in, all out? What is the meaning? Is poor disinfection, but the disinfection was done. It's extremely difficult, and it's really difficult for you to arrive to a conclusion. The host immunity status. Why? Because you have in conventional herd, relatively low virulence APP will not cause disease. But when you arrive to high health status herd, you can have disease caused by, let's say, a serotype 12. It can cause disease in a high health status herd, but not in a conventional herd. It is clear that high health status herd, free from all serotype of APP and free for mycoplasma and many others infection, are more susceptible, which is at first glance does not make any sense. But you have to think that most conventional herds are infected, colonized, in fact, not ill, but low virulent strains of APP that produce some levels of toxins that are usually present in circulation, the antibodies. In those high health status herd, there are no APP. So there are almost no antibodies against those toxins. So is the hypothesis that we have? We are not sure, but it is clear. Let's have an example. This is in Mexico, a herd with no clinical signs of APP. Nothing was there. Everything was calm. All of a sudden, there are incoming gills in a high health status herd, and in a very few hours, you have a high mortality of gills and then even sows that were present. So nothing happened in that herd, but these animals from a very high health status farm, they were much susceptible. You can see how adult animals are heavily infected with respiratory problems in the farm. So have to be careful because these kind of animals may be very susceptible. So coming back to the major relevance, APP as a primary agent of respiratory disease. We said yes and no. Just see an example. It was a real example. I was contacted because it was a recently populated commercial herd in Europe with clinical problems with an APP serotype 9, a highly virulent serotype. The multiplier supplying replacement animals are positive in serology for APP9. So obviously the commercial herd that didn't have those problems before, clinical problems, they say, oh, if the multiplier is positive in serology, perhaps we have been contaminated. But usually people with the first reaction will be, serology is an indirect diagnostic, probably a false positive. You know, I worked in serology for many years and nobody believes us until you have a problem. But serology works very well for APP. But they say, okay, serology is only antibody. So it was decided to go for tonsils because there were no clinical cases in the multiplier and see if we could isolate the APP serotype 9. And yes, the APP serotype 9 was isolated from tonsils using a special technique. And we compared both strains from commercial and the multiplier, so clinical and tonsil. They were identical by genotyping with a similar antibiotic profile. At that moment, I'm talking of around 10 years ago, no whole genome sequencing was available yet. So, but we did that to compare, and when you compare using this technique, when two strains are different, you can say they are different. When two strains are identical, you cannot say that is the same strain. That is one of the problems. So the commercial herd blames the multiplier claims that it's not the same strain because it is not virulent in their farm. What happened? This was a case in the court. The judge ordered an experimental infection. So we had two groups of 10 animals plus one sentinel, 1 week of age, animals negative to APP, mycoplasma, and peers, intranasal infection with high number of bacteria. No fever, no clinical signs, no mortality, no lesion, no difference in average daily weight. At that moment, we ask ourselves if we really infect the animals, but we detect in the APP serotype 9 in tonsil of all 10 animals, plus the sentinel. And there was a strong antibody response in all infected animals. So, first conclusion was the serotype 9 is a really non-virulent strain. Problem was when we were finishing the trial, new information arrived, and the breeding herd, the multiplier, was completely free of mycoplasma, but the commercial herd became positive for mycoplasma a few months before. There was not a lot of lesion at the slaughter. Some lesions were there, but a clear seroconversion and PCR positive for mycoplasma. So, new hypothesis was a strain that is not able to cause disease in one herd may cause disease only with the presence of mycoplasma. So the judge again ordered a new experimental infection. What was the difference? We have the control group, uninfected. We have the APP infected group as the first time. But we have another group that at 7 weeks of age was infected with mycoplasma, and 4 weeks later infected with APP serotype 9. Always the strain isolated from tonsils from the multiplier. The control group, obviously the pigs were very healthy. In the APP infected group, as in the first time, pigs were completely healthy. What happened with the APP myco infected group? Then we have a lot of mortality. I mean, respiratory problems, vomit, 1% of morbidity. 4 out of 10 animals died with typical lesion of pleural pneumonia and some lesions of exotic pneumonia, detection of APP and myco in all affected animals, and detection of antibodies against myco and APP in all infected animals. So that is why I indicate that APP may be a loner and cause disease alone, but sometimes may need some help. So it is extremely important to evaluate the whole herd before applying some measures, which are at least my intention for the take-home messages. That obviously the PRDC is a complex syndrome, sometimes a teamwork, sometimes not. It's not always a teamwork, but sometimes yes. And there are a very thin line between these two situations, because usually what we have are results from the lab, and we base almost everything on the result of the lab, and we should pay more attention to that. APP is really a complicated infection, and you need to perform a complete diagnosis of the situation. Isolation, serotyping, toxin profile, to know exactly what you do have in your farm. Are there mixed infection? Is this a higher virulent strain? Both. You can have the both situation, and also try to evaluate other cofactors. I'm saying that because sometimes a single action to control the infection, let's say a vaccination, may be not enough. Sometimes I contact telling me the vaccine is not working. But just to give you a very recent example, in South America, one country, a herd seriously affected with relatively good mortality by a serotype 12, which is extremely rare. So before going and applying a vaccine for a serotype 12, you need to, because it's usually low virulent, you need to evaluate the whole, because if there are many other problems in the farm, only with a vaccine against the APP serotype 12 probably will not be enough. A vaccine may be good, but you need to explain why are you having those problems. So as explained to my students here, vaccinology is really an art more than a science, because you need to know about how is the behavior of everything and to see if this can be enough to control an infection or not.